All right, Mark, thank you for that. More now on the coronavirus here in Connecticut. Research shows that people 65 and older are at much higher risk of developing severe COVID-19 symptoms, including the risk of hospitalization or death. Joining me now to talk about this is Dr. George Kucheel. I hope I'm pronouncing that right, the director of UConn Center on Aging. Thank you so much for being with us this afternoon.
My pleasure.
So what type of an impact are you seeing from COVID-19 on the older adult population?
Well, it's both physical, as you mentioned, in terms of increased risk of hospitalization and severe disease, disability, and death. But it's also mental and behavioral in terms of being isolated and not seeing one's family and not being able to conduct one's life as normal. So it's really a very mixed picture.
Yeah, very isolating for a lot of those seniors.
Exactly.
One of your studies is about the effectiveness of the flu vaccine after a patient has recovered from COVID-19. What are your findings there?
Well, we're still in the early stages of this, and I should emphasize, first of all, that the flu vaccine is even more indicated now than ever, and I would strongly encourage everybody to get the flu vaccine, particularly if they're older, particularly if they have chronic diseases. It's very, very important. And this particular study, which is in collaboration with the Jackson Lab for Genomic Medicine, which is directly on our campus, we're actually recruiting older adults and younger individuals who've recovered from COVID and administering the flu vaccine. So if they've not had the flu vaccine, we're actively recruiting and looking at whether they are able to mount the same kind of immune response that they would have had they not had COVID. And we know this is very important because we know that aging and chronic diseases actually do diminish the effectiveness of vaccines such as the flu vaccine, which is why it's so important to come up with other treatments, other approaches to dealing with COVID.
Right, so much to learn there for so many people. So should older adults be included more in more COVID treatment trials?
Absolutely. And in fact, a recent paper published by colleagues of ours has shown that in spite of aging being such a tremendously important risk factor for COVID, many studies, in fact, more than 50% of current ongoing COVID trials and almost all vaccine trials have excluded older adults. So because of that, we're actually conducting a number of studies here in addition to the one you mentioned, including one that is actually testing a drug that is designed to target biological aging as a way of boosting immune responses and improving recovery from COVID. For that study, we're recruiting people over the age of 65 who've either been recently diagnosed with COVID and living at home, or who live with somebody in the same household who has developed diagnosed COVID. So that particular trial, you actually don't need to even come in. It's all done from the comfort and safety of your home. We contact you by phone, and everything is done remotely. And the phone number for that is 844-925-8500 if anybody's interested.
All right, hopefully we can get that up on our website. Some important research being done there for sure. Dr. George Kucheel, thank you so much for being with us this afternoon.